my presentation today, we will go now to other point of view. My preceding speakers talking about the finding on Down syndrome people, how to treat their problem, oral health problem for with Dr. Layla that she spoke about, and for the ear disorders, how to treat, how to manage, how to go. For me, I'm going with another scenario, how to prevent, how to let these people to live in a healthy field, how to try to diminish their problem and to let them to live in our life as normal people. Actually, we will go about practical oral care for people with Down syndrome. To provide the oral care to people with Down syndrome, it requires adaptation of the skills that we use every day, as well as to build a strategy. We have to keep in mind the prevention as a priority. We must not deal with Down people as they are always like sick people, disabled category in our community. We have to give them the tools how to live in a healthy way. As Dr. Layla mentioned, that we have so many health challenges that I will not go through to her. She covered it in a very good way, and how to manage it in dental treatment with intellectual disabilities, the behavioral management that it must be, the medical condition, cardiac disorder, kind of hypotonia and scissors. I will go through the prevention in oral health problem, which is the periodontal diseases, dental caries, oral facial features, the malocclusion, tooth anomalies, and how to deal in cases of trauma and injury. For the periodontal disease management, we have to encourage very early the independence and daily oral hygiene, even by the child itself or by a caregiver and family. We have to give them the starting of that very early in their life. We have to encourage it. We have to make sharing with the parents and family. How to start this? Maybe we can use a powerful toothbrush or a floss holder. It can simplify the oral care. Of course, some of them can do this independently, and some need the help of their caregiver. Maybe we can give like a hands-on with the family, with the parent. We must not expect that everybody knows the basic, how to do the proper brushing, how to make a proper flossing. Simple tools and simple ways of demonstration with them can help a lot. Maybe we can give a group like gathering of people, of some children with their family. We keep it in mind to make it in a proper way and how to make it in similar way every day, in same position, same timing. Okay, sorry. Also, the antimicrobial agent. We can start using the chlorhexidine, which is one of the best recommended, of course, according to the availability. If the patient has, the child has a swallowing difficulty, maybe we can use the spray type. If he can do it and can expectorate, we will use the oral lens. Emphasizing again about the importance of daily oral hygiene and the frequent professional cleaning. If we go about the dental caries management, that Dr. Layla covered it very properly about the causes, and that maybe it is, the child has a little risk of dental caries, but actually we find it. There is so many reasons, there is so many factors contributing to dental caries, but we face a dental caries in the children. So one of the major problems that we have the xerostomia with the natural cleaning effect of saliva is not available. So we have to emphasize the drinking of water in a plenty way. We must recommend the preventive measure, such as the topical fluoridation in the form of sealant, fluoride varnish, and toothpaste of fluoridated one in gel or rinse. Of course, that it is covered by so many of our doctors that we have to emphasize the non-carcinogenic foods and beverage in snack. And as Dr. Layla mentioned also, it must not be rewarding for children in any kind of their life. As we know that we have some kind of cases that it need of regular medication, we have to go for sugar-free medication if it is accessible. From these two major important problems that we have in oral health, we can get that our keys of prevention is optimizing of the oral hygiene, dietary modification, and the fluoride. Fluoride is the key agent in battling the caries. It works primarily via topical mechanism about inhibition of demineralization of tooth surface, enhancement of remineralization, and inhibition of bacterial enzyme. If we can see in this slide that the fluorine ion, when it is present in the patient mouth, it replaces the oxide ion in the hydroxyapatite compound of the enamel surface and give a new compound, which is the fluoroapatite. This fluoroapatite is one of the most resistant type against the invasion of bacteria. And also we can see that so many laboratory and epidemiological researches suggest that fluoride prevents dental caries predominantly after the teeth eruption and into the mouth, and its action primarily are topical for both the adult and the children. Like so many sayings before, it's talking about the systemic fluoridation. In DOMS people, we cannot go through it so confidently because, as you know, we have different rate of eruption and there is so many challenges in that. So the topical fluoridation is our best. If we go back to the oral health problem, as Dr. Laila mentioned also, there is so many factors, there is so many oral facial features, there is so many teeth anomalies and abnormalities. To overcome and to prevent any struggling in this issue, we have to examine the child by first birthday. Let's say it can be after 6 months. The delay of this visit will take us to so many challenges that it can be prevented if we go to early checkup for the teeth to follow the eruption scenario, and maybe we can use the radiograph when it can be accessible for them, especially the panoramic X-ray, that can show the sequence of eruption and any kind of missing congenital teeth. Of course, that will give us to maintaining the primary teeth in a healthy condition as its need. We increase the need of it because of the delayed eruption of teeth. Actually, the completion of eruption of permanent teeth for the down people, maybe it will last up till 14 or 15 years of age. That's really increase the need for the primary dentition, and we need to keep it in a healthy way as much as we can. Malocclusion cases. As they mentioned also, there is so many defects in maxilla. It can make some kinds of open bites, cross bite, the hypotonia in the muscles, so many factors that lead to different cases of malocclusion. We have to go for orthodontic care, and it can give a great help. For other oral health problem of trauma and injury, this part is very important also, that we have to alleviate the tooth saving for group home. We have to give the scenario for caregivers that are surrounding any child that maybe he has some kind of disability or even normal child. So many of us, we face that in a tooth fall, an accident, or there is complete exfoliation of a permanent tooth. Simple tools can be done to clean the tooth and try to put inside the socket immediately after cleaning it, and so fast to go to the dentist. Immediate professional attendance for fixation. Or in case that it is a part of the tooth, if a small fragment is fractured, we have to allocate or instruct the people around the child to allocate where is this part and to try to get it. By some of the disabled patients, it can be swallowed or aspirated. So also we can alleviate the radiographic chest for patient. One of the main important helpful tool is the preventive community program. The preventive community program increases parent awareness. It also lets us to gain the confidence and cooperation with the Down children. It enhances the easy access for the treatment. when we are as normal people around them, going to them, and the community is sharing with them, this will give them too much cooperation. And we are so proud that our dental department in GHA, with the help and collaboration with the Emirate Dawn Association, for the last 5 years, we are sharing with them in a dental day, where we are organizing a full activity of day. We are giving them, let's say it's a nice day for us like for them. During this day, that since 3 years also ago, we start to introduce our van, the mobile van. Then we go to visit the association. We spend a full day of activity with them, where this is a van. That's in this photo during one of the activity days, where we can share with the parent with a simple lecture introducing for them how to manage their children from dental point of view, how to give them the dental care in a simple way. Also, some simple health education way, how to brush the teeth, for the kids and their family also. Simple games to teach them about the geriatric dentistry. And nowadays, with our van, it gives us access to make a simple checkup for them, and also to put some simple preventive measure like the fissure sealant and fluoride varnish. Actually, this type of days makes us so happy, and our group is keep on increasing every year. It was a fun day for them, but it was a challenging day for us. We know how to communicate with this sector of our community. Okay, to summarize now what we are saying about prevention now, let's introduce a simple preventive program that it can be, you know, all of you, that the prevention must start early in life, when the children is still newly born. When we start early, we can gain a lot. So, as a simple program to maintain for dental health care, let's start from age 0 to 3. Maybe the visit, as we mentioned, for the dentist, when the first tooth erupt. When starts the eruption of teeth, we will go to the dentist to identify the need of fluoridation protection, how it can be, how we can start. This will be so helpful. Also, we have to start the use of toothbrush and fluoridated toothpaste, of course, as we mentioned before, according to the ability of the child. In the small children, maybe we can use a short smear of toothpaste. After that, the pea-sized size. Of course, we have to emphasize the breastfeeding. It gives a great role in the hypotonia of the muscle. Some of the children can benefit a lot from it. And maintaining the healthy diet, no sugar, no fast foods. If we go through the age 6 to 15, we have to maintain the oral health care, the use of fluoridated mouthwash and like Hexidine, and introducing flossing under the supervision, plus the visit to the dentist to maintain the gingival health care and to start putting the fluoride protection in the form of sealant and to identify the orthodontic problem. This is the best time to identify these issues. So if we do it in that time, you will get benefit a lot. Actually, the change in dental health of a child with Down syndrome may go slowly, but with constant maintenance, it can lead to positive results that can not only influence the health of their teeth, but the quality of their life and the future as well. Continuing of the program, when we go to age 15 and above, we have to maintain an oral and gingival health care. We have to try to replace the missing teeth by different prosthetic appliances. But this step must be done after the completion of the facial growth, with the crown, bridges, or different kinds of implant procedures. Actually, the area of dental care, such as cosmetic dentistry, orthodontic, and reconstructive oral surgery, it should not be ruled out simply because the patient has Down syndrome. As with the number of persons that are working and living out in the community, many of them who desire and can handle extensive dental treatment available option. And finally, if you can see that the quality educational program and stimulating home environment with good health care and positive support from family, friends, and community, it enables the people with Down syndrome to develop their full potential and lead fulfilling lives for them. Thank you very much. This is just a short note about the preventive point of view, but of course, if somebody needs to know more about the prevention, we have to go through a complete preventive program. Thank you very much for you.